Welcome. Today we are going to break down the essentials of Medicare Part A so you can understand your benefits better. Medicare is a federal health insurance program primarily for people age 65 or older, but it also covers certain younger people with disabilities. It's designed to help cover the costs of healthcare, but it's important to know what each part covers to maximize your benefits. Medicare is divided into four main parts: Part A, Part B, Part C, and Part D. Each covers different services. Let's focus on Medicare Part A, which is a key component of the original Medicare program. Part A is often referred to as hospital insurance because its primary coverage relates to inpatient care. The core benefit of Part A is covering care received when you are formally admitted to a hospital as an inpatient. However, Part A covers more than just acute inpatient hospital stays. It also includes several other crucial services. This includes short-term skilled nursing facility care, which is typically needed after a qualifying hospital stay for recovery or rehabilitation. Medicare Part A also covers hospice care for terminally ill patients, offering comfort and support services. Finally, certain medically necessary home health services, like skilled nursing care or therapy, are also covered under Part A. Now, let's talk about the cost of Medicare Part A, which can be one of its most appealing features for many. For most people, Part A is premium-free. This applies if you or your spouse worked and paid Medicare taxes for at least 10 years or 40 quarters. While the premium is often zero, remember that deductibles and coinsurance for hospital stays and skilled nursing care still apply and can be substantial. Understanding who is eligible and how to enroll in Part A is crucial for accessing these benefits. Generally, you are eligible for Part A if you are 65 or older and are eligible for Social Security or Railroad Retirement Board benefits. Enrollment can be automatic if you are already receiving Social Security, or you may need to sign up during your initial enrollment period around your 65th birthday. Part A provides a foundation of coverage for significant medical events, offering peace of mind related to hospital and post-hospital care. To summarize, Part A is your hospital insurance, covering inpatient hospital stays, skilled nursing facility care, hospice, and some home health services, often with no monthly premium. While Part A is essential, it doesn't cover everything. Your next step should be to explore Medicare Part B for coverage of doctor visits and outpatient care. We're making a full series on the parts of Medicare, so make sure to subscribe to the channel right now. You don't want to miss the next video where we dive deep into the costs of Part B.